on this episode of The Natural Plastic Surgeon. So it seems like it was yesterday for me because I remember this operation. It's one of the most challenging operations. We did a tummy tuck. We did a male gynecomastia, a reduction. We did a unique way of doing this that's completely different, preserved a lot of sensation in the natural feel of the nipple.
Yeah.
We did lots of liposuction. It took us 8 hours.
8 hours.
To do this operation. This was no joke. Hey everybody, it's Dr. Barrett. We're here, the Natural Plastic Surgeon Podcast. I've got a special guest on the show today. He's had a surgery over a year and a half ago and had an incredible transformation. And so he's here today to talk about all of the things that happened. I want to back it up. I want to start to how you lost the weight, the surgery. How have you been since then? It's been a year and a half. So Brent, welcome to the show.
Thank you for having me.
Absolutely. So let's first of all, let's dive in. This is him before and this is him after. What an incredible transformation, Brent.
I can't believe the transformation.
Do you even remember what it's like to
I don't. I even look at old pictures and I'm not even sure who this person is anymore.
Right. I mean, it seems like it was yesterday for me because I remember this operation. It's one of the most challenging operations. We did a tummy tuck. We did a male gynecomastia, a reduction. We did a unique way of doing this that's completely different, preserved a lot of sensation in the natural feel of the nipple.
Yeah.
We did lots of liposuction. It took us 8 hours.
8 hours.
To do this operation. This was no joke. It's funny. Let's back up. So what happened? Like, let's start from the beginning. So you lost 110 pounds. There's a lot of people out there that are worried about losing weight because they know they're going to have a lot of excess skin.
Yeah. And
they don't want to do that, or they're worried about what might happen, when they do lose the weight. So let's start over. Let's start from the beginning. What happened, and how'd you do it, and how'd you end up here?
Well, I was overweight for most of my life, like from childhood up until adulthood. And, I went to elementary school. Luckily, I was not teased. In high school, maybe a little bit. And then into college, I was still overweight. So it was almost as if I was content with my weight at the time. But then, as you grow older and then, you want these like relationships, whether it's like romantic or just friendships. And then you realize, what is it about me that I'm not in these relationships? I know that can be a little bit shallow, but, I was looking for a change. And so my friends, they did this program and, they lost weight as a couple, and it interested me because I was thinking, oh, maybe I could do this too. So then it wasn't until I was maybe like in my early 30s where I asked them, and I took this program seriously. I said, okay, I'm going to do it. If it works, great. If it doesn't, let's just see how it goes. And then I did the program. I lost weight immediately.
Well, what was this program? I mean, people are dying to know.
It's called, it's gone through many name changes, but it was Medifast.
Medifast?
Yes. Okay. And then now it's become a different name.
Okay.
But yeah, I did the program for 10 months, or I did the program, and I lost weight. Like within the first week, I lost 11 pounds. And after that, I would continually...
First week, you lost 11 pounds?
Yes, 11 pounds.
Okay.
And then week after week, you would lose like 5, and then it would gradually get lower. But I kept up with it for about 10 months because my goal was to lose 100.
Yeah.
And
well, how heavy were you when you started this?
I believe I was like at least 310 pounds.
Wow.
So.
And how tall are you?
I'm only 5'3".
Yeah. So that's a lot.
Yeah. So yeah, I lost the weight after 10 months. I got to my goal after 10 months, and I decided to go up, go for a little bit more weight loss. And so I did. And then I reached my goal. I shared it with everyone that I knew. It was such a, great program. And
well, all right. So tell me more about this program. You said it's called Medifast.
Yes.
But was it exercise? Was it like starving yourself? Was it keto? Was it paleo? Was it calories in, calories out? What was it?
It was very similar to like Jenny Craig, where you buy meals meals from their program. You eat it like 5 times a day, and then you would eat your own, like they call it a lean and green, which is basically a protein and vegetables.
Okay.
And so it kind of teaches you how to eat, regularly. Like you have to eat every 2 to 3 hours and drink a lot of water. So it's giving you like healthy lifestyle, tips.
Okay.
And so I've actually used those, post the program, and it has helped me maintain the weight loss.
Got it. Was there any exercise tied with it, or was it just strictly diet?
Initially, no. They didn't recommend it because it was like lower calorie intake.
Yeah.
But as your body gets used to it, then you can start adding activities. I added hiking, and then eventually I started to play tennis again, because I always played tennis as a kid.
Yeah.
And it wasn't fun running around when I was heavier, but now that after I lost the weight, I was able to be an even better tennis player. So.
Great. All right. So how long did it take you to lose this weight?
It took almost a year. And then I've just maintained that weight loss for maybe 4 years until I decided to finally get the excess skin removal.
Okay.
And because I was very naive, I thought, if I keep at it with exercising, working out, I'm gonna, lose this skin somehow.
Right.
But, I guess in the back of my mind, I was trying to just avoid getting the surgery. But then I faced reality. Yeah. And then I started doing some research, and it led me to you.
Well, tell me about the skin. What kind of problems was it causing for you?
Especially when I would be, running around the tennis court, I would always hear the like flapping noises, and it would prevent me from. I was always very self-conscious anyway, so that the noise didn't help me. I couldn't fit into the clothes that I wanted to comfortably. But there would always be some kind of parts of my body sticking out, or that I was just not happy about. So,
wow. Okay, so I wasn't your first consult though.
No.
Right? You reached a point, you thought about it for a while, and then how did you start your process of like really trying to figure out a solution for this?
For me personally, whenever I make a goal, I just say to myself, here, I'm going to do it. And I just like dove right in. I went on the internet, and I researched a bunch of websites like Real Self, and I just typed in tummy tuck, and then I just see what would show up on the search engine. Yeah. And then it wasn't intimidating at all, just hearing all these stories of like how long the surgery would go, or, any problems that could go on from it. But I was doing the research, very extensive research.
Was most of it on Real Self?
No, I would just...
That was just a starting point?
Yeah, that was just a starting point.
Okay. Just for the listeners out there, if you're not familiar with it, Real Self is a website that is kind of focused on plastic surgery procedures, where you can learn more information. I have a profile there, so we'll link it to the show notes for you guys to check out my profile on Real Self, and you can actually explore it if you want to see where Brent started, I guess. Was there scary stuff on there, or
there were some scary posts, but I was just so focused on wanting to do this for myself that I would not let any of that get in my way.
Got it. Yeah. There's pros and cons to everything.
Yeah, of course.
All right, so you left Real Self, then you started digging deeper in research. What else did you do?
Then after I did the research of getting over that hump of like what to watch out for, then I would look for surgeons in the LA area and in the Valley, closer to where I live. Yeah. And I went into the consultations, and I asked all the important questions. And one of the most important things for me was to know that the surgeon had worked on men. And because you can go to their website and you can see tons of pictures of all of their work, but I was very focused on making sure that they had previously worked on men. Yeah. And a lot of them have, but at the same time, I wasn't getting the what I wanted from the surgeon, and it wasn't until I got to you where I felt like you really cared and you were very enthusiastic about wanting to work on me.
every time I get a patient, it's such an incredible amount of work to go from where you started. Probably, I don't have any photos, I'm sure you do, but of where you started before the weight loss to where you were when you showed up in my office. And it's just like, I get a great chance to take care of something that you can't take care of yourself. And it helps me. I like it because I like to say, I like to put the finishing touches on all of your hard work. And it is hard work. This isn't easy.
Yeah.
So I do get excited because in my mind, I'm visualizing the before and after. Like I'm visualizing like all the positive things that I know are going to happen to you after we do the surgery. So I'm still excited. All right, so let's continue on. So you came and you went to four places. Is that correct? Okay.
Yes.
And you started and I really think that's. You got to get your basics. Are they board certified? Do they have before and after photos? When they call the office, does someone pick up? Are they operating out of the garage? You know what? You know, all the red flags to avoid.
There was one that actually felt like they were working out of their garage.
Really?
Yeah.
Where was that? Well, I don't want to.
I know it was
cast shade, but
somewhere nearby.
Where is it in the valley?
No, it was here.
Is it Beverly Hills? Oh,
like adjacent.
Okay.
And I didn't feel like you already know the red flags when you walk in there. And I immediately knew I didn't want to go there.
Yeah. I mean, it's just like when you go to a restaurant, you know, you can judge the kitchen cleanliness by the bathroom cleanliness. You know what I mean? And so it's just like when I walk into a room, if I see hair on the floor, I'm picking it up. I was like, I can't have my, you know, I just, one, I'm kind of OCD like that. But two, it's just like, I don't want my patients to make judgments based off the cleanliness of our floor. So we have a robot, we have sweepers, we have everything. So I have like 2 cleaning crews that come in here, 3 actually. So one for the ORR, one for the front, and then another one for the front, just once a week to make it clean. So that's my little OCD secret. But yeah, so that is so key. You got to make sure you find somebody that cares about what they do, and it's not a factory, right? Because this is your body. You know, you need to find somebody who's passionate about it. I think for men especially, you got to make sure that it's someone who's familiar with, and I've done a lot of male weight loss patients, some major ones where I've been on the TV show The Doctors For, and they're complex and they're different than female operations. And so those are things that you have to take into consideration, especially with the male gynecomastia. That's super challenging to do that right and to make that look good. We got the before. Now you showed up in the office and then you decided on surgery. Tell us about surgery.
Was
it in this room? Do you remember?
It was. I remember when I walked in here, I'm like, this is the room where I walked in, I was given anesthesia and I just was conked out. I don't remember a thing.
That's the idea, right? It's just like, hey. Yeah.
I don't remember a thing until I woke up. And I felt like for me, it was easy because I didn't have to do anything. Like you and your team had to do a lot of work.
We went from 9:45 to 5:45.
Yeah.
So that was an 8-hour operation.
Yeah. It was, I mean, to me, it felt really easy and great because I woke up and I just remember laying here and I'm like, oh, like I made it, you know?
Yeah. That's great. I mean, we inject a lot of numbing medicine. And sometimes we have that long-acting pain medication. I can't remember if we used that for you.
I remember.
We did.
Yes.
Yeah. So that probably helped you out a lot.
Yeah.
And I want to do a quick recap of the surgery. We did a tummy tuck. We did liposuction, abdomen, and flanks. We took off 1,000 cc's off of each flank, and then we took off about 300 off of the front of the abdomen. So that was, it's close to almost 3 liters of fat. The right breast tissue removed about 700 grams, and the left breast tissue removed about 870. That was important because you had some asymmetry there. Abdominal tissue removed was approximately 7 pounds. And we have a picture. Can we pull that? You have it on your phone.
Yeah.
So we did a Snapchat of your surgery, and we'll actually pop that up here right here during the podcast, so you guys can see it if you want to check it out. It's on our YouTube. When did you see that? Did you see that night or the next day?
I saw it actually the next morning, and it was weird to see at first because then I saw everything that you did, like the first incision, and that was a little, I'll just say it, creepy to see at first. But then seeing how much you took off, I'm like, that was what I was carrying all this time
every day,
and I felt like, I couldn't do anything about it. But then
That's why I'm in business. It's like, I wish there was a way. Someone would make a lot of money if they could figure out a non-surgical way to get rid of that skin.
Right.
And it just really, when there's that much, there's not much you can do.
Yeah.
And but I think the key is to do it right. And so, was there an immediate relief right after surgery, after you got the skin off, or was there a lot of soreness? You couldn't really tell right away.
I couldn't really tell right away. I did stay at an aftercare close by. The name has left me at the moment, but
it Serenity or Beverly Hills Aftercare? Or?
I think it was Beverly Hills Aftercare. Okay. And it was a great experience. I made sure to book with an aftercare just to make sure if in case anything happened.
Oh, totally. I mean, like there's so much surgery and there's so much fluid changes, and it's just helpful.
Yeah. I mean, when I woke up, it was recommended to walk right away. And
absolutely.
They helped me through that. Even going to the bathroom was a struggle. But I made sure to go to an aftercare and make sure they helped me first 24 hours.
Yeah, so you're there for one night.
Basically.
Yeah. Okay. Yeah, that's really smart because you're just totally out of it after an 8-hour surgery.
Yeah.
So when was like the first time you looked in a mirror?
It was hard to get out of bed. Yeah. So
I don't even think they have mirrors at the aftercare facilities probably.
I don't think so.
Yeah.
But I think it was the first day I got home, and I looked in the mirror and I just saw this bandage. I could feel the swelling and the numbness, which I know was normal. And I didn't freak out because I prepared myself. You prepared me, and all my research helped me deal with that. But I looked at myself in the mirror. I saw the tape. I'm like, I can't believe it's done. And I was just so happy that I made it through.
Yeah.
Because it was such a long surgery. But I was so relieved when I saw myself. It was like I just could not believe it happened.
Yeah. That's awesome. It's a real change.
Yeah.
And it's a fast change. Like when it took you 3 years to lose, or how many years? How long did it take you to lose 110 pounds?
It took me less than a year, but it took me 3+ years to make that decision.
Okay. Well, still like a year, like a little less than a year, still a long time, right? So it's got to change. And then all of a sudden, one day, boom, you have an operation, and everything's different.
Yeah.
So it's like, that's honestly when I go back to why I chose to be a surgeon. There's a lot of reasons, but one of them which is I get to make changes on a pretty quick basis. Internal medicine doctors are great, but if they're managing someone's diabetes, that takes days and months of active monitoring and stuff like that to really make a difference in someone's health. I get to make a change in a single day. Yeah. Obviously, it's a single day of surgery, but there's pre-op and there's post-op care and all this other stuff. But you get what I mean.
Yeah.
So it's really satisfying. Mm-hmm. Tell me about your family. What did they think?
My parents, they weren't so thrilled about me getting the surgery at first, just because they're old and they are.
Mom and Dad, you're old.
They are, and they just freaked out over just me getting surgery when they felt like I looked fine. But I see myself in the mirror every day, and I know what my flaws are. So, but they were okay with it. But I kind of told them a little too late because I already made the decision to do it.
Hey, by the way,
they couldn't do anything about it. Yeah. But they were supportive, and they were ultimately just happy for me that I made this decision to do this, and that I had lost the weight too. So I have an older brother and older sister, and they were very supportive because they know all the hard work that I put into losing weight and maintaining it. So
great.
I had a lot of support, and my friends too. So.
And so did people come visit you afterwards, or was there a support network there, or was it just?
It was mostly, I just wanted it to be family, immediate family to be with me. And, I didn't want people to come to my house. So I just, once I was able to get up and go around, I would, see people. And they were so amazed. It looked like as if I didn't get surgery. I had,
awesome.
Yeah. I had a friend that said, you just had, how long was your surgery? And you're up and about running around. And I remember one of my friends saying, and I'm sure it's true, that however fast the recovery is and how is due to the doctor, the surgeon. So obviously did a great job.
I think it's a combination, right?
Yeah.
So I think it's a combination of a lot of the things I do during the operation to minimize your pain, so forth, like the injection and numbing medicine and the techniques that I use. I don't use cautery for everything. The taping that I do, and then also I think a lot of it has to do with you. How well do you follow instructions? How are you getting up, moving around? Your attitude on things, all those things. That all matters.
Yeah, that's one like advice I would give to a patient that would want to get a tummy or similar surgeries to me, where you have to have a positive outlook. You take things as they come. You can prepare as much as you want, but
What was something that shocked you? What was something surprising?
I think fitting into clothes. I mean, that would be natural. Fitting into clothes better.
Really? So right off the bat, so like, did that happen right away, or did you notice that?
It happened right away.
Wow.
Yeah, and I just remember old pictures of myself where I would look at myself from my back, and I would see how wide and large my back was, but I see it now. It's a lot more like V tapered, like a V shape.
Hell yeah.
So
it's masculine. It's always great. And that's the difference. That was on purpose, because you don't want an hourglass shape like a feminine for a man. You want a V shape.
Yes.
So that was built into your operation.
Yeah. Thank you.
Yeah, of course. Yeah. No, that's the difference for sure. And you had so much skin. We had to chase incisions along the chest wall all the way back, and they healed beautifully. We just did a 1.5-year follow-up.
Yes.
And you look phenomenal. I think there's some things that we can fine tune. Anytime you have this is a really important concept, and I am a really good surgeon. I try really hard. But everybody heals differently. And sometimes there's little edges and things like that, or just a little bit loose, or you maybe lost weight or gained a little bit of weight, that we can always fine tune. So I tell people the first operation is typically about a 90% kind of, 90% of the work, and then expect to have like another 10 to 15% kind of updates as things heal. And that happens with these massive weight loss situations. And I think in your situation, phenomenal difference, but there's little things that we can fine tune. And I think overall you're healing, you healed beautifully, better than I expected, actually.
Yeah, a lot of people have said that. Like, they thought it would have taken so much longer, or other things could have happened, but no, everything was just like smooth for me.
Awesome.
So that was great.
Well, tell me about what's different now. You're back to playing tennis?
Yeah, I'm back to playing tennis. I play a lot of tennis.
That's great.
I'm a lot more social now. Like before the surgery, I was always very self-conscious. Even nobody would notice, but I always was aware. But whenever like I'm in a tennis league, they would invite me to stuff like, hey, let's hang out, let's go to this, let's come to a party. I would always say no, because I just didn't feel like it. But now, and I'm sure you can ask my friends, they say he's a lot more social now. He comes to our party. So I'm a lot more social, and overall I think I'm just happier, and people can see that whenever I walk into a room or whenever I catch up with someone. They're like, you have this glow about you. Yeah. So I'm just so much happier.
Well, you do. You look really happy, Brent. I mean, I'm so happy that you are doing better, both how you look, how you feel, because that's to me what really matters. Because ultimately what we did was functional and cosmetic for you, but if you're not feeling better about it, then I don't feel like I've helped you significantly. You know what I mean?
Yeah.
So I feel so good to hear. It makes my week, actually. So and that's why I love my patients and following up and making these transformations. It's just incredible to hear that.
Thank you.
You're welcome. So I guess it's 1.5 years out, and looking back, I know it's been some time, but so if there's a guy out there or gal out there that's lost a lot of weight, what would be your advice to that person if they're thinking about doing something like this?
I mean, personally, I think just my process where, I do as much research as I can, as you can.
Yeah.
And
where do you start with research?
I looked up just tummy tucks, and then I would let that kind of lead me to other things, and for people to be aware of other procedures that you might need as well. Yeah. And you never want to be surprised when you look up a surgery or for like something like this.
Right.
And then you have to find the right surgeon for you, and be patient, because you may want this overnight fix, but it's not. It all starts, like for me, it starts mentally, and then and psychologically, and the physical, it'll come like easy. So that's my advice.
Okay. I mean, it's just it's such a hard thing to,
Yeah.
because it's like, I come back here and I take people into the operating room and I transform them, but I do that every day, and it's just like, for someone who's never had surgery or never even seen surgery, it's like, it's a very daunting thing to like completely trust somebody, go under anesthesia, which is kind of scary. It's actually really safe, but it's kind of scary. And then wake up and get through it, and recover. It's just like a huge thing that nobody really knows about until they dive in.
They do it. Yeah.
It takes a lot of courage.
Yeah.
Especially in your operation. I will say that your operation, I remember, it was one of the most challenging operations of 2018.
Really?
Yeah. It was so challenging, and I think it turned out great, and we're so beyond happy for you and your transformation, Brent.
Yeah, I just have to thank you and your team so much. It's completely changed my life, and I can never be like I don't know if I can repay you or your team.
No, you already paid us, Brent. It's okay. So, yeah, I mean, we're not the cheapest in town. I will tell people that. I think it's because we work really hard for our patients, and we do take more time. But, we care about the details. The way I look at it is, you don't want to bargain shop for parachutes or plastic surgery. It's your body. You only get one, right? As far as we know, unless you believe in reincarnation. But for the most part, it's like, it's a long time you have your body, right? Yeah. So it's like, it's not like a car. If you don't like the leather seats, you can trade it back in. It's your body. And if somebody messes up or your life is in jeopardy, it's never worth it.
Yeah.
So.
And you were very insistent in our post-op meetings. Like, it was every week, or
it was a lot.
Yeah. So
we were watching everything.
You care so much.
Yeah. we don't want to have wound breakdown. You healed so well. I'm like, I saw you today, and I really couldn't believe it, especially the chest incisions. It's like, you can't even notice that you had surgery there. It blended in so nicely.
Yeah.
So that makes me feel really good, because I typically don't see my patients beyond a year. And so it was great to have you come in and see that. Yeah. And I think a lot of that was it was with you too. Positive attitude, following all the post-operative instructions. Like, don't commit to something like this unless you're really committing to it, right? Like, do everything that you need to do to heal. Otherwise, you're not going to get the best result, or you could get a complication.
Right.
Yeah. So, Brian, well, I can't thank you enough for being on the show. Is there anything else you'd like to share with the viewers or the audience, or me?
I actually brought a gift for you and your team.
You didn't have to do that.
So this may be a little difficult to open.
Okay. All right. So it's a green It's a green bag. Is that?
I don't know.
Is it your favorite color?
It is actually.
Green's your favorite color?
It is.
Oh wow!
But as you know, I like to bake, so I made.
You made these?
I did.
These are macaroons.
Yeah, wow. Rose water are the pink ones, and the orange one is chocolate ganache. So.
Oh my goodness! All right, well, I'm gonna have to have a bite of one of these. This is, even though it's like it's against my paleo ways, but these look so good. Let me try this out. Wow, phenomenal! Okay, oh my god! Now, Brent, what do you do for a living? Because we should make these professionally.
I've been thinking. Actually, I started a page for my baking. So
really,
yeah. And
you have a website?
It's an Instagram page.
Okay.
So.
Well, what's your handle? We're gonna send some people there, because these macaroons are amazing. Wow.
It's kind of difficult to spell. Well, not really. It's bits, BNT bites. That's my handle or screen name.
So BNT bites, BITES.
Bits, BNT bites. That's
bits,
one word.
BNT bites.
Yeah.
Okay, cool. We'll put that in the show notes so people can check it out, and you can learn more about his cooking endeavors. Yeah.
Yeah. Well, what I do, I work in music publishing.
Okay.
So I do all the administrative work, but we collect music royalties.
Okay.
For music used in commercials.
Yes, that's a big deal.
That's all my boss is doing.
Yeah.
So, but I've been there for a while, and I enjoy the work. It's a really low key, fun environment, and it's close by here. So
good. We'll come by anytime, Brent, especially with macaroons like that. That's awesome. All right. Well, good, Brent. Well, thank you again. Thanks for being on the show. Give me a hug.
Thank you so much.
Yeah. We're really a pie, so.